I'm curious, how does the individual human story, how has that changed the way you think about what kind of requirements might be appropriate in the world of health equity? We talked about time and distance being something that may need to evolve. I'm sure there's other measurements that come to mind, but when you listen to real people, how does that influence your thinking about what should matter?
Sure, so a couple things come to mind. One is every state's different, right? And so the particular things that we heard about from Washington, D.C., for example, are different than what I'm going to care about in Minnesota. As a specific example, we have 11 federally recognized tribes that make up a good chunk of our ecosystem and have really important goals that they want to achieve for the healthcare of their members. That's not the case in DC, right? DC also has some of the biggest health disparities within like a 10-mile radius, so they have other kinds of challenges. So from a macro perspective, every community in every state has a slightly different story to tell and slightly different needs. And so I think that's important to recognize, especially as you're thinking about state and federal requirements. But the second is that the stories that each person has are sometimes what you would expect and sometimes not. We had a member of the disability community advocating or giving a presentation, and she said, actually, I don't care about specialists at all. I know who my specialists are. I know how I'm going to get them. I really need an excellent primary care doctor. And she said people often come to her and say, well, you need good specialist care because you have a lot of specialists. And so listening and hearing those kinds of subtleties in the way that a person wants to interact with their healthcare system are really important than to say, okay, well, how do we, that's a human. Here's my plan. Here's the plan in the company, and then here are the regulations, and make sure that you can kind of take that through that whole process.